Hello, I'm Dr. Brandt Gibson, and I want to talk to you now about when surgery should be done for hammertoe deformities. As we've been talking about the last couple of days, we've talked about hammertoe deformities, which is the contracture of a toe, either at any one of the digital joints or oftentimes at the metatarsal joint and the digital joints, which causes a curving of that toe where it's hammering on the ground and causes pretty significant discomfort, pretty significant pain. And the idea here is, when should you be doing surgery? Just because you have hammer toes is not a good enough reason to say, I'm going to do surgery now for my hammer toes. Hammer toe surgery should be done for one reason. The hammer toe is starting to interfere with your life. Now, that may seem pretty broad, and so I'm going to break that down just a little bit more. There are 4 reasons why I would do surgery for hammer toes, or I'd recommend surgery for hammer toes. Number 1 is significant pain. If you're having pain all the time, it's interfering with your life and it's causing problems with shoes or whatever, it's a reason to do hammer toe surgery, because the post-operative pain as you're getting better is usually an improvement from the pain you're having regularly, and you know it's getting better, which actually also makes it work. Number 2 is if you have some kind of nerve disease like peripheral neuropathy or diabetic peripheral neuropathy, and you're worried about sores and wounds and so forth, and you have some areas that are really rubbing and really causing issues, especially in shoes. The idea is you're rubbing on the top of the shoe, or you're rubbing on the right at the tip of the toe because of how curled it is, and it's causing possibility of wounds, sores, and long-term problems. Again, that's another situation where it's interfering with life. I do recommend that you do surgery in that situation. Number 3 is it's causing deformity in other areas because of the hammer toe. Say you've got a hammer toe and it's crossing over the big toe, it's causing pressure on the big toe and maybe causing other issues. If the hammer toe curls enough, you start to get room for the bunion to move over and move under. All of those are reasons to do surgery if you have hammer toes. And the 4th is if you're already doing a different surgery. So if you're saying, okay, I have a severe bunion that's painful and problematic, and I'm doing that, but I also have a hammer toe of the second toe, you might as well do that second toe at the same time, because it doesn't lengthen the recovery. It does make it hurt a little bit more, but the whole idea is by fixing everything at once, you really don't have to go through the surgery a single time. So that's probably the only time when I say, yeah, I would do the surgery, even though it personally is not interfering with your life. Because there is another deformity that you're fixing, you might as well fix the hammer toe at the same time. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget Day 256, when you should do surgery for hammer toe deformity. Now, in saying that, we don't do surgery just because they're there. That's one thing I want to reiterate as we're closing here. Thank you, and have a great